to Roberto Accinelli. Roberto Accinelli, MD, MPH, is Associate Professor of Medicine at the Universidad Peruana Cayetano Heredia. Did I do that okay?
Excellent.
UPCH. The Associate Director of Research at the Victor Alzamora Castro Postgraduate School of Medicine and member of the Board of Directors of the Instituto de Investigazione de la Altura de UPCH. He is the coordinator of the Strategy for Tuberculosis Control at Cayetano Heredia National Hospital. He was the National Coordinator of the tuberculosis for the Minister of Health 2001-2002, and Director of the Department of Tuberculosis and Treasurer of the ALAT. A member of the Planning Committee of the Assembly of Microbiology, Tuberculosis, Pulmonary and Infectious Disease for the American Thoracic Society. Dr. Accinelli is an inspiring mentor to many students and young physicians. 3 of his former mentees have been recognized for the best MD thesis for UPCH. Dr. Accinelli regularly attends the ATS International Conference, and since the year 2000 has raised money to bring 5 to 15 of his mentees with him every year. 10 of his trainees have obtained ATS travel awards. In the 1980s, he developed programs for patients with tuberculosis to obtain free treatment. He established the first retreatment program in 1984 in an area where more than 1,000 patients needed second-line drugs. He established the first asthma program of the Peruvian Health Ministry in Lima Norte Health Region, and he obtained about a 70% reduction in the retail price of inhalers for the program's patients. Dr. Accinelli has reported that exposure to biomass fuels in Peru is associated with respiratory and extrapulmonary diseases because of its inflammatory state that it produces. He demonstrated that well-designed biomass stoves decrease the respiratory burden and was awarded the Golden Pacific Prize for his work. His research began a national campaign, 500,000 improved stoves for Peru without smoke. This campaign has been cited as the most cost-effective intervention to be done in third world countries. It is with great pride that I present the American Thoracic Society's World Lung Health to my friend, Dr. Accinelli.
Dear friends, going to my first ATS conference was an unimaginable experience. When I returned some years after to Seattle, the big escalator, do you remember that? Was not as big as I remember, but the friendly face of Carl Buber saying, "Sir, nobody has come to this conference from Peru during many years. Welcome to the ATS conference," was the same. And I have received the same hospitality from all the members of the ATS. Here, I learned that the smarter you are, and the more research you do, the more humble you become. And so, it is easier to learn from you and to share your dreams. Every one of my friends here, such as Yash Snyder, who proposed me for this award, are a sample of generosity and passion, making the best of their jobs and spending all their times in service to the others. So, all of you inspire me a lot. I was supported by Roberto Sanchez de Leon, prematurely deceased, who used to come here from Venezuela with young students to present their research, and I wanted to follow his example. Without the understanding of my lovely wife, Carmen, who permitted me to split our money and time between our 5 children and my research and teaching. Without the support of our young physicians and students who do an excellent job for no monetary reward, without the support of their parents, who allowed them to work with me, and finally, without the support of the ATS, who support my students with travel awards, it would not have been possible to follow in Roberto's footsteps and bring delegation year after year from the Cayetano Heredia University. This award will be not for me, it will be for the 11 million Peruvians and for the 3 billion citizens of the world who continue using 3 stone stoves. We need all the people to know the intensity of this problem and the simplicity of this solution. $30 per home would be of huge benefit for their condition. There is a war campaign with the goal to put 100 million good stoves into homes. We, all that are here, the pulmonologists, must be the voice of these people who do not have a voice. Thank you very much, ATS, for giving me this undeserved and unexpected award.